Myopia is otherwise known as short-sightedness. That is, the patient is able to see only near objects and not able to see distant objects. That is what is meant by myopia. And this is generally a condition connected with the anatomical measurements. That is, we know before that we have to understand what is the vision, how vision is obtained through our eye. The light rays which is reflected from the object is travelling parallel in the air and it is reaching the eyeball. Then it will pass through the eyeball and will get converged on a particular point on the inner layer of the eyeball, that is retina. And this is the first step of the vision. And while passing through the eyeball, this parallel rays will get refracted so as to converge on a point. And this refraction is made possible by 4 different refractive media of the eyeball. First is cornea, then second is a fluid medium, that is aqueous humor, third is a bile-convex lens, and fourth is a gel-like semi-fluid vitreous humor. And the refraction of these 4 media are in such a way so that the light rays are getting converged or focused on a particular point in the retina. If it is not possible and the light rays are focusing or converging in front of the retina, that condition is known as myopia, because they are not getting vision properly in that distance. So what happens, we have to use some device to get it converged on the back, little more back side. For that nowadays this concave lens is used. This is what is known as myopia. So if from that we can understand that the curvature of the cornea and then the length of the eyeball, that means the anteroposterior diameter, these are highly influential in this particular process. So this becomes increased or is according to the growth of the patient. So the growth is mainly from the age of 5 to 20 years. Up to 5 years the development is going on, and after development then comes the progress stage. Progress means growing stage. So during this particular period the length of the eye becomes more and the curvature also becomes more, like that some changes are happening anatomically, and this anatomical variations influences the myopia. That is why it is we can just be aware about the common people. We can see that the child the myopia may be developed in most cases before the age of 10 years or 10 to 15 years maximum. Then it becomes progressive as the child grows. That means when the distance becomes more, distance means from the retina to the cornea, it becomes more, the light rays again getting converged still more front. That is what is simply progressive. This will happen up to the end of his physiological growth, that is up to 19 years or 20 years, like that. Then we will simply say myopia is progressive in nature. There are 2 types of myopia in its development pathological level. One is what is described now, it is physiological myopia or anatomical myopia, which is more concerned with the anatomical variations, anatomical structure of the that particular patient. There is another group, that is pathological myopia, or different terms are used for that, pathological myopia or progressive myopia or degenerative myopia, like that. In that condition there will be some pathology behind this other than the anatomical variations or anatomical changes. So in that group, this progression of the disease will not be stopped by the stoppage of the physiological growth, since it is a pathology. That may be some hormone changes or some changes in the retinal cells or the fibrous coat or the curvature of the cornea, like that. If there is a pathology behind that, this change will be progressive even after the age of 19 or 20 years. It will go up to any level, and in that type of myopia, complications are very serious, and in that case the vision may not be corrected with the glasses. That is another dangerous situation. In anatomical myopia, it can be corrected by according to necessity. We can use lenses which is having refractive power. That is, in myopia it is minus, that means concave lens. But in this case, since it is not because of the refractive error, or otherwise it is only a part, in this pathology refractive error will be only some fraction, some part of the pathology, and some other factors are there, and it is not because of the refractive error. That cannot be corrected with the lenses. So this degenerative type myopia cannot be corrected beyond one level. So we can say that the vision is, measurement will be, for example, 6/36, and the normal vision is 6/6 according to the Slanus chart. There is another measurement by 20 meters like that, then 20/20 will be normal. And if you are using appropriate lens, it should be corrected to normal, that means 6/6. And if it is not getting corrected to its normal vision by any lens, then the condition becomes serious. It will not be improved further with any lens, or by increasing the power of the lens, vision cannot be corrected. That type of myopia is termed as degenerative myopia or pathological myopia. There comes the importance of Paka treatment. Here the refractive error is only one sector, so that change can be corrected by lenses. Further improvement may not be possible. So if it is a refractive, for example, let us say the vision is 6/60, and if you are using -6 or -5 diopter glasses, it may be corrected up to 6/12. Then there is no further improvement. That is the situation. And if this pathology is further progressing or further growing, then this correction will be getting less and less and less, and finally it will lead to complications. And the main or most dangerous complication is retinal detachment. As the cornea becomes thin and getting more protruded, or if the sclera is getting expanded, then what happens, retina may not be stretching to that level, and sometimes it will be becoming more thin, and in the final stage it will get detached from its underlying layer. That is known as retinal detachment. That is a very serious complication, and it is developing blindness. So if it is treated appropriately in the early stage, then sometimes retinal attachment is possible by surgical level or by medicinal level also. It is possible, but in the later stage, if the retina has already changed its position or its a cellular level, then it cannot be possible by any method. So retinal detachment in a degenerative type myopia is a serious complication which may lead to total blindness. Then if you analyze this situation on the basis of Ayurvedic theory, we can say that all the three doshas, that is Vata, Pitta and Kapha, are equally important, and we have to consider all these three factors in the realm of treatment. Sometimes in one particular patient, one dosha may be a little high in level than other two. So that should be considered more seriously. For example, if a patient is Kapha dominant and having this type of disease, we have to consider Kapha as the first factor. If he is a Vata dominant patient and is having this type of progressive myopia, we have to consider Vata as the basic factor and treat for the 3. In that way only we can control the pathological myopia. So generally speaking, it should be treated in a systematic way, not a superficial way. We can't treat it. We can treat, but result will not be to a desired level. And so for that, there is its own line of treatment. Just like first we have to do one thing, that is Snehapanam, then comes Nasyam, and then comes next level ocular treatment. Like the step by step treatment is necessary, then result is very good result is there. So first we have to consider, always we have to consider which dosha is coming prominent at that particular clinical stage. We have already seen that there are different factors influencing, and so different doshas will be dominant in different clinical stages. So at that level, or when the patient is coming to treatment, we have to find out which dosha is more dominant at that particular time or at that particular clinical stage. Accordingly, we have to start the treatment. That means the treatment will vary from patient to patient on the basis of the severity of the case, body condition of the patient, and also the time when they are coming for the treatment. So to handle the pathological myopia on a medical level should be by an expert hand only, because the fomentation cannot be done if the retinal detachment is there, and if there is too much fluid this type of thinning of the retina is happened, then we cannot do some particular type of medicines or treatment procedures. Like that should be very careful, but if treated in time in a correct way, only medicinal treatment can give better results. If there is no detachment, or we are getting the patient in the early stages, we have to start with strengthening the retina first. For that, oral medications are there, and also treatments on the higher level, that is on the head region, and also ocular treatment procedures are there. Then in the next level, we can do something to avoid further complications. For that, what should be done? Some simple medications are to be followed. If 3 doshas are equally important, generally it is better to start with the treatment of Kapha. And Kapha Shamana, to release Kapha is to avoid or to drain out the unwanted accumulations, and it is just like a cleansing type of treatment. And then we can do the nourishing type or strengthening type treatment measures, the procedures can be done. Then it will be perfect. For this, the treatment procedures are mainly Nasya in the case of Kapha dominance, and Shirodhara etc. for the dominance of other 2 conditions, and Netra Tarpana is the main treatment procedures for the maintenance of Vata. If you are doing these procedures in the apt time, correctly diagnosing the clinical stage, then the treatment will be highly successful. Anyway, the result or the aim of the treatment is to gain better vision. That is sure. So first of all, we have to see whatever device, whatever method he is using, the patient, he or she should get normal vision. So here in this degenerative type myopia, there lies the problem. He is not getting full vision, or his vision is not get corrected to its perfection with any external device. So that means if we are going for a checkup, and there will be a reading process to measure the visual acuity, and if he is not able to read full lines or full sentence, even with any increasing the power of the lens, there starts the problem. So if the patient is saying that he is not getting full vision or not able to read the desired lines even with the changing or increasing the power of the lens, then we have to take that situation in a serious level. Then only medicinal approach will be the better option. So it is our responsibility to avoid such a situation. If the situation is getting progressive and the correction become less and less, this disease is becoming progressive. So take the treatment as early as possible. That means when the patient say that he is not able to see full sentence or not able to read the normal line, normal size of the letters, then have a second option. Treatment is for the disease, not for the age. So when the patient is met with a problem, the treatment should be started immediately, because anyway we have seen that there is a anatomical factor also behind the development and progress of the disease. So the disease also will increase according to the age or according to the growth of the child. So it is better to start the treatment as early as possible. If he is having some mild problem or initial signs and symptoms, by starting the treatment at that point, it will not get progressive. That can be arrested at that level, and we can bring it in normal in an easy way. Waiting for a treatment for years, just like for this LASIK treatments, it can be done only after the completion of treatment and the growth. So if the patient is a 9-year-old boy or a 6-year-old girl, it is not advisable to wait for 12 years to get appropriate treatment. By Ayurvedic methods or by medicinal approach, we can avoid the progress of the disease and protect his vision. We have already seen that this disease has a relation with the growth, physiological growth. So by the age of 9 years, if the vision has come to full correction, then also if there is a possibility of further development when he is according to his growth. So it is better to have an eye behind this problem until his growth is finished, up to the age of 17 years or like that. And if the problem is very serious in the early age, then it is possible to bring it normal stage by stage, because already the disease in a progressive level as the physiological growth is happening. So we have to fight against these two factors. One is the progress of the disease and one is the complications. So it is better to make corrected the problem stage by stage. So usually it will take 2-3 years. If the condition is too serious, just like it is counting fingers only or below 6/60 in Slender's chart, it will take some time, some 2 or 3 sittings or 2 or 3 hospitalized treatment will be necessary. And anyway, in my experience, in 99% of cases, the prognosis is very good and in very high level improvement is there, and vision is gained to full correction in almost all cases. So if your child is diagnosed as myopia, have a keen observation whether it is progressing in nature or it is totally arrested by this usage of glass for a long period like that. and don't waste time to get appropriate treatments, because correct medicinal treatment in time can protect his vision and avoid the problem of the short-sightedness in future.